All my life I was dreaming to be a nurse. I was trained in Poland, so when I moved to Scotland, I didn't speak English at all.
After I left school, I worked in the cashier's office in what was the old Dundee Royal Infirmary, and I always wondered what went on behind the screens and the medical side of things.
Nursing seemed to be more patient orientated, where you could actually be involved with them and spend time with them. It's amazing some of the lives that people have led.
Almost 30 years ago I worked in a day centre with people with Alzheimer's disease, and I found I really enjoyed it, and I kind of wanted to find out a bit more and how I could help them in a better way really.
We spend a lot of time with residents when they first come in, talking through their life history so that we know lots about them, so that if their condition was to deteriorate further down the line, we always have these prompts that we can still have conversations with them about things they would remember.
Well, it's just an extension of sort of that person's life. Just because they live here, I don't see there's any reason why they still can't have links to the community, as normal a life as they possibly can have.
You can't just see that person coming in the door as somebody old who's had a stroke. It's not a name and a diagnosis. It's a person that's had a life. They've lived through wars, they've lived through so many experiences, and we can learn so much from them.
I understand the people, they moving from her own house, moving for a different place is actually very, very difficult. There are a few minutes with the personal touch with the person, to stay with somebody who is in bed, who is all day in bed sometimes because he's not well, I think is a very, very important.
I think nursing's not so much a job as it's a passion. There's not a day where I leave the building and think, I really haven't enjoyed my day. It's probably been very stressful. We have a lot of challenging behaviour at times as well. But when you walk out the door at night, you do have a feeling that you've done well and that you've made a difference.
Maybe a lot of people might not think that you see improvement in places like this, but you do. Maybe something that they've not done for a wee while, and just a smile even, just wee tiny things. It's just wee small improvements that people that know the person can see.
At the end of their life, to know that you've helped them, be peaceful and have their family around them and be in a homely environment for them as much as you possibly can, which means they're not sitting in a hospital. I think that's probably the most rewarding part, because it's the last thing you can do for someone.
The best things is for me if somebody is happy, if they're happy with my work, I'm happy too.